Perfectionism isn't about high standards. It's about a deep-seated fear masquerading as control. For those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And in today's video, I want to do three things. First, I'll tell you the story about a patient whose perfectionism was ruining her life and filling mine with anxiety. And second, I'll talk about what perfectionism actually is, how it's less about high standards and more about fear, control, and the need for safety. And finally, I'll teach you how to recognize the perfectionistic tendencies in your own life, the ones that may be holding you back, and how to soften them without reducing your drive. And finally, at the very end, I'll give you some tips of how to manage some relationships in your life with people who might really struggle with perfectionism, because you know that can cause tension. So let's start off with that patient story from my training days that really taught me a lot about perfectionism and filled me with anxiety too. And of course, anytime I talk about patients on this channel, all details have been significantly changed to protect patient privacies, of course. But my experience, my lessons learned definitely are real. So I was just starting my third year of psychiatry training, and the first 2 years were all spent in the inpatient setting. So working in very high acuity situations, very mentally ill patients. I was working on hospital floors, psychiatric hospitals, emergency rooms, and everything in between. Now for my third and fourth year, I was transitioning into the outpatient setting. So sitting in an office, patients come to see you of their own will, and you manage their psychiatric problems with therapy and medications. I was ready to start the chill life. No more unpaid overnight calls or having to manage aggressive, angry patients. Life was gonna be good. And the senior resident that was managing the clinic ahead of me was giving me the handoff. So telling me about some of the patients that I should be aware of, what changes they're making, what they're working on. And when we came to a patient that I'll call Mary, the senior resident definitely warned me. She said, Robert, you better be careful with this one. Whatever you do, make sure you're not a second late. Make sure you don't say anything wrong, get anything wrong, or even think anything wrong. That's because she struggles with OCPD, obsessive compulsive personality disorder, or basically this really intense sense of perfectionism. To myself, I kind of thought, okay, how bad can this possibly be? I think I'll manage just okay. And then a week later, time came around for Mary's appointment. And I saw she was a little bit later in the afternoon, which made me a little bit nervous because I had to see every patient and then present their case, what's going on, to the attending in a separate room. The attending is the senior psychiatrist who's supervising us residents, talk about what's going on and my plan of what to change, how to move forward. And of course, that can cause some delays, especially if you're still new, starting out. I was still getting used to how to work the electronic medical record on the outpatient setting, how to navigate my time and everything that came along with that. So I was still a bit rusty, running late, and I noticed that I might be late with Mary. So I got a little bit nervous. I was supposed to see her at 3 p.m. and it was 3:05, and I was still with the attending talking about the prior patient. And that's when I heard my pager going off. I looked down at the pager, and yes, we still use pagers. I think they still do. And the pager said, Dr. Radoshak, you need to get over here right now. Your patient is upset. I'm like, okay, I can't answer the page in the moment. I'm still with the attending. I still have to wrap up with that patient. So I get another page. Dr. Radoshak, we're calling security if you don't get here. Patient's getting aggravated. And of course, I've seen my fair share of aggravated patients. Conflict with patients, their families was nothing new to me. I felt very comfortable with that. But something about this made me feel particularly uneasy. I felt tense and exposed, like I was failing somehow in my first week. And that sense of insecurity, that was the first clue. Before I talk about what happened next, let's talk about what perfectionism actually is. At its core, perfectionism is best understood as a belief system that we hold of how we can best feel accepted, respected, and safe with others. It's the recurrent unconscious question of, if this isn't done perfectly, something bad will happen. I won't be safe. Now I'll come back to that in just a moment, but let's get back to what happened with Mary that first day. When I actually got back to the waiting room after another 10 minutes, my heart racing, I was kind of sweaty, feeling very tense. I enter the waiting room and there's no one there. It's just the front desk staff staring at me, looking very frustrated with me. I walk up to the woman at the front desk and she tells me, no, Dr. Robert, that patient got very, very upset. And if this happens again, we're gonna have to block her from the clinic. And I'm already feeling tense, one little bit self-righteous, like, oh, she had no right to be so upset. That's unprofessional. Maybe we should ban her from the clinic. And then also the other thoughts were, what did I do wrong? How did I mess up? How could I have gone about this better to have avoided this conflict? So I was starting to get the hint of some perfectionism, or the anxieties it instills are a little bit contagious too. So I went back, told my attending what happened, and he was very kind and nice about it. He knows this patient, he knew that was gonna happen, and I think he was kind of testing me as well with it. He just told me, fine, let's just reschedule her for next week and we'll see if we can see her on time. First patient of that day. And sure enough, next week, she was there early and I was as well. I made sure to have my shirt tucked in, my arms were back. I felt a little bit stiff myself, a little bit anxious going into the waiting room, but I did it. I entered it and there was Mary. She was sitting there, also sitting up straight, impeccably dressed, not a single hair out of place, makeup fine-tuned to her skin color. And yeah, there she was. Looking at her, I felt a little bit anxious. And but she didn't betray any frustration from the prior week. She stood up, followed me to the office, and I was very tense the whole time. I was particularly aware of my movements and everything. And once we sat down, I could see her looking around the office, looking at my diploma, my books, everything, judging, assessing, probably both. And I reviewed her chart before, so I knew that she came from a very wealthy family. A lot of perfectionism was probably ingrained in her parents, who were both professors, and she was an only child. So I got the sense that probably mistakes were seen as unacceptable. Perhaps love from her parents, appreciation, it was all contingent on whether or not she performed perfectly in their eyes. I also knew that she had no long-term relationships. She was really bright, really well talented, but she was not able to advance in her career, and that caused a lot of frustration and shame and doubling down on perfectionism. Her original chief complaint to the clinic was, I'm here because my boss tells me I struggle with perfectionism. So her presence was even a little bit reluctant, and I think she kind of struggled with the whole idea of perhaps she struggles with perfectionism. And that clued me in that maybe she wasn't even fully insightful that the perfectionism might be a problem. But soon there in my office, I started asking her the regular questions that we all have to ask, mainly for insurance purposes, right? How's your sleep, energy, appetite, and all the other list of questions. Her answers were brief, precise, and I felt the tension mounting. I could sense myself avoiding the prior week's incident, and I was kind of stuck thinking, is she thinking about it? Is she judging me? And I remember a key lesson from early on in my training was, if you're avoiding something in the room, that's probably definitely the thing you should focus in on, bring out into the open. So I took a risk. I stopped typing and I looked at her and I said, I know that I was late last week. And I know that caused some issues and some frustration. I'm hoping to maybe better understand or hear how that made you feel. She paused, then calmly said, I experienced that as disrespect. And of course, right, that triggered a wave of anxiety, of shame in me. But then she continued, when someone is late, she said, it tells me they don't take their work seriously. And if my doctor doesn't take his work seriously, I don't feel I can trust him. In the moment, I felt terrible. I apologized. I blubbered through the rest of the interview. But when I was speaking with the attending later that day, he told me, Robert, kind of, what did you experience there? What are some lessons from this interaction? I started talking about, I could be better, more efficient next time and all that. And he just stops me. He's like, no, that's not the lesson here. You're always going to be like, there's always going to be an imperfection. It's not about trying to mitigate that. That's the cycle that Mary is stuck in. What can we learn about this interaction? What's the lesson learned here? The lesson was this. Perfectionism is inherently a need for control to gain safety, about needing the world and the people in it to feel predictable, to feel reliable, and doing whatever you can to maintain that reliability, that sense of control. That's why I would frame perfectionism not as a trait, not as a psychological trait, but as a strategy to maintain a sense of control, even when it's not possible. That's a strategy that usually develops very early on in life, especially if there's a lot of trauma, instability, a lot of perfectionism from parents and caregivers. And control becomes a substitute for safety, and the false promise becomes ingrained in us. If you do everything right, nothing will fall apart. Everything will be safe and okay. But the cost of that promise and that temporary safety is very high, because the world doesn't work that way. The world isn't safe. It's not predictable. It can't always be relied on. Imperfections will continue to appear. And if we're constantly seeking to mitigate them with control, well, then our world will shrink. Our ability to have any degree of safety will always be contingent about how much control do we have over a situation. How perfectly does it align with our vision, our view, our belief? We'll continue to be frustrated, not take action due to fear over it not being perfect. And so perfectionism doesn't reduce anxiety. It just organizes life around it. And the more extreme this becomes, the less one can actually maneuver in life. And paradoxically, the less control we actually feel that we have. So if you're watching this, I want you to ask yourself a few things. 1, do mistakes ever feel dangerous rather than disappointing? Do delays or imperfections in things cause disproportionate amounts of distress and pull you away from the present? Do you often feel very responsible to prevent things from going wrong? If that's the case, definitely don't worry. That's something we all experience to some degree. It's not a source of weakness or anything like that. It just tells us that our nervous system, for a variety of reasons in our life, has learned that control equals safety. So before I tell you how my time working with Mary ended, I want to fill you in on some strategies you can employ into your own life to help with reducing the negative effects of perfectionism. So first off, let's talk about how to better recognize when perfectionism tendencies are arising in us. You can feel like a tightness in our chest and our bodies, like this restlessness even, this need to create or exert some degree of control. The question you want to ask yourself in those moments is this about preference? Something that's not going well? Is it normal irritability? Or is there a degree of danger in this feeling? Does the lack of perfection feel like a threat? Is it really intruding on my thoughts, on my ability to appreciate things, enjoy myself? And even that awareness can offer a little bit of space, a little bit of recognition of what's going on, and offer some reprieve. And second, identify the rule behind the perfectionism. Because oftentimes, it's driven by things that are unspoken, these beliefs we hold internally. If I make a mistake, I'll lose respect. If I don't do this thing perfectly, something bad will happen. I'm only safe if I stay in control. So use this exercise. Try filling out the sentence yourself. If this isn't perfect, then blank. Whatever fills in that blank is the belief that needs attention, not the behavior. So let's do an example. If I don't write the script for this video just right, people will comment on me about it negatively in the comments, right? So sure, I want to write good scripts, spend time on them, evolve them, but I only have so much time and I got to release them weekly. So for me, that would be, how concerned am I? And to what degree is that preventing me from doing the things I want to do? Maybe I got to change my belief system around it, right? Not to creating the perfect script every time, but a good enough script that I feel creates some value and conveys some useful message and isn't offensive or too out of character from the vibe I'm trying to give off. At least that's the perfectionism I've been working on in my life. If you have some things you want to work on, you're working on in your life right now, definitely leave comments down below. I'd love to hear about your guys' struggles with perfectionistic tendencies. The third one is really important. Start practicing separating standards from your self-worth. This is one of the hardest but most important shifts I'm going to talk about. Because you can still care deeply about something without tying your self-worth to it. Because in perfectionism, who I am equals how I did. And that is a huge part of the problem there. Because if everything you do reflects directly on who you are, well, you're going to set yourself up for a lot of self-shame and need to control things more, right? It's going to often come up with work, right? If I don't give this presentation well, do this task well, then that means I'm useless, your self-worth goes down, and that doesn't help you, right? That doesn't help you navigate the situation, doesn't help you think flexibly, and then makes you double down on your control instead, and that doesn't work out well most of the time. So instead of asking yourself, did I do well? Ask yourself, did I do reasonably well? Did I learn something from this? Did this create some meaning? What are some ways I can maybe improve upon in the future? And thank yourself, also create some appreciation for having taken the effort, for having tried and attempted something, even if it didn't work out. At least you tried, and that's more than most people can say. That brings me to step number 4. Build tolerance for safe imperfection. This involves being intentionally flexible with things. So perhaps send the email without rereading it 3 times. Leave a task 90% complete. Allow yourself to be 5 minutes late if you really need to once. Well, speaking of perfectionism, I actually filmed this video a few weeks ago, maybe even a few months ago, and my camera died on me as I was filming, and I didn't notice. So coming back now, gonna finish it. Might be imperfect because of it, but I appreciate you understanding. All right, so where did I leave off? I think I was talking about strategies, and I'm just gonna skip ahead to the most important, perhaps, strategy for any anxiety, especially anxiety, discomfort associated with perfectionism. That's how to view it. Maybe changing one's relationship to how one approaches perfectionism when you start to notice it. And that can be viewing it with curiosity rather than resistance or frustration. Let me explain. Curiosity tends to diminish any sort of negative experience we're experiencing internally. So instead of being frustrated, maybe asking yourself, why am I so bothered by this? What is this perfectionistic part of me right now trying to prevent? What is it trying to control? And is that really necessary? Is that degree of anxiety, perfectionism really appropriate for this situation? Maybe even if it is there another way, a healthier, more efficient way I can approach it? Because perfectionism tends to soften when it feels understood rather than attacked. Okay, now let's shift to what probably everyone's wondering about. How do I manage someone else's perfectionism? Because that can also create a lot of tension, a lot of strain in relationships. So perhaps there's like the coworker whose perfectionism gets in the way of meeting deadlines or working smoothly. Or perhaps a partner who's very rigid about things and struggles to tolerate any sort of lack in consistency or anything else that's distressing. Or a family member who has very high expectations and constantly leaves you feeling less than. Well, first off, let's talk about what not to do. I think the instinct is typically to confront them, attack them. Why are you being so rigid about this? Why does this even matter so much? Why do you have to be so perfectionistic? Because as experience may have taught you, that doesn't really work out, right? If it did, it wouldn't be much of a problem. They would just change their behavior and their expectations. But often, too often, that's sort of met with them doubling down on their beliefs, their rigidity, their perfectionism. That's because perfectionism is not driven by logic. Logic doesn't work there. It's driven by a sense of fear, insecurity. So first thing that can be useful is sort of understanding, one, that perfectionism is occurring. That's coming from a place of insecurity, anxiety, lack of safety. So kind of asking yourself, why may they be reacting in this way? What might this behavior, this rigidity, be protecting them from? This doesn't excuse the harmful behavior, but at least helps you understand it, which allows you to then react more effectively. And this allows you to set boundaries without instilling shame. Healthy boundaries sound like, I care about you, but I may not be able to do this perfectly. Or I hear your concern, but I'm personally comfortable with this being good enough. Because boundaries aren't punishment, they're clarity. Next, don't get pulled into the perfectionism cycle, right? Because as you heard from my experience, it can definitely be contagious, right? It can have you questioning yourself. What, am I actually doing things poorly? Am I not living up to a expected standard? So that's a thing that you can get drawn into, but it's important to recognize that because it's likely to happen when you're interacting with someone with high perfectionistic tendencies. It's important to recognize that and sort of notice and allow yourself to pull back, to give yourself some grace. This is especially true if you notice yourself walking on eggshells around this person, feeling very hesitant, anxious, even at the thought of interacting with them. And often the most helpful thing you can do in those situations is not need to rescue yourself or rescue their distress, but sort of allow the distress to rise and fall and just be present, be still with it, which is, again, easier said than done. But that tends to also help not reinforce their perfectionism or make them believe that, anytime that they raise alarm about something not being perfect, you'll always respond. Because that doesn't teach the right lesson to them nor to you. Also acknowledging their distress, letting them know, I realize how difficult this is for you, how distressing this is for you. Do you want to talk about it? Do you want to address this in a helpful way that allows us both to move forward? Language like that can be helpful. And sometimes if you're just being met with a roadblock, taking some space can be helpful as well. So let me close out by returning to the story of Mary, right? Because I continued working with her for 6 more months, and the more I worked with her, meeting her every month, I realized that, she was struggling. Life was not easy for her. And I began to understand why. And that allowed me to start helping her in a way that I don't think was possible in the very beginning. And I began to realize that her own perfectionism was exhausting to her. On many levels, she was not happy with it. She didn't like being this way. And anytime she tried to interact with someone, they would confront her perfectionism head on and try to exert logic on it or argue with it. And that just reinforced her fear that I'm not right, I'm not perfect, I need to double down, And that just led to so many issues in her life, despite her being a very pleasant, smart person. So over the course of these sessions, our work didn't become trying to fix her perfectionism or help her relax. It was to help her become more aware of it and understand where it was coming from and find some alternative ways of dealing with distress, dealing with upset, or a sense that she might disappoint someone or herself. Now, my last day working with her, I decided to throw in a little experiment. I intentionally was 3 minutes late to our last appointment. 3 whole minutes. I sat in my office, really anxious, looking at my pagers, seeing if it would beep, but it did not. So I went to the waiting room and saw she was sitting there, not looking distressed, waiting, and looked at me. She stood up and walked up to me and followed me back to my office as was our ritual. And she walked in, sat down across from me, and my heart was racing. I was expecting a tirade, a beratement of some sort, that how could I be late, especially for the last session, how disrespectful was that? But instead, she kind of smirked at me. She kind of looked at me like, Dr. R, I sure as hell hope I pulled off that last little test you just pulled on me. And then we both cracked up laughing. It was the most genuine, lighthearted moment I'd experienced with her during the whole course of treatment with me. And it was kind of sad to part ways with her. It was time for a different resident to come into the clinic and for me to hand off. And yeah, I don't know how she's doing now, but that was a very, very educational teaching experience for me, and I hope for her as well. And now I hope you guys can learn from it too. So my friends, I hope you've learned that perfectionism is not about excellence. It's about fear dressed up as discipline. And the goal isn't to stop caring. It's about to feel more human. And to be human is to be imperfect. You can be imperfect and still feel safe, still feel connected, loved. And that's always the goal, no matter whether you're a perfectionist or not. I hope these lessons resonated with you. If you enjoyed, please consider liking and subscribing. Still a new channel, and any interaction and engagement is always very much appreciated and welcome. Thank you so much for your attention, and I hope to see you next week.